What is ovarian tissue freezing and fertility preservation? Have you ever wondered how women can preserve their fertility when facing medical challenges? Ovarian tissue freezing is a fascinating and innovative technique designed for this purpose. This method involves surgically removing small pieces of ovarian tissue, which are then frozen and stored for future use. It is particularly beneficial for women who may lose their ovarian function due to treatments like chemotherapy or those who are experiencing early menopause. The basic idea behind ovarian tissue freezing is that ovarian tissue contains thousands of immature eggs. By freezing this tissue, it may be possible to restore ovarian function later or retrieve eggs for fertilization when the woman is ready to conceive. While this technique is still relatively new and not as common as egg or embryo freezing, it provides hope for women who cannot undergo egg freezing due to time constraints or other reasons. The procedure itself involves a surgical operation to remove the ovarian tissue. After removal, the tissue is frozen using specialized techniques. Once frozen, the tissue can be stored for many years. When the woman decides to try for a baby, the frozen tissue can be thawed and reimplanted into her body. The goal is to restore ovarian function, which may allow for natural conception. Alternatively, eggs can be retrieved from the reimplanted tissue for use in assisted reproductive technologies, such as in vitro fertilization. There are several benefits to ovarian tissue freezing. It offers an option for women who may not have time for egg freezing due to urgent medical treatments. This technique also has the potential to restore natural menstrual cycles and fertility. However, it is important to note that the procedure is still experimental. Risks include complications from surgery and the possibility of incomplete restoration of ovarian function. There is also a small risk of reintroducing cancer cells if the tissue is contaminated. Ovarian tissue freezing is particularly relevant for women facing fertility challenges due to medical conditions like endometriosis. While endometriosis itself does not directly affect the success of ovarian tissue freezing, it can complicate fertility preservation. Women with endometriosis may struggle to conceive naturally and could benefit from techniques like ovarian tissue freezing, especially if they are undergoing treatments that impact their fertility. In summary, ovarian tissue freezing is an emerging technique that offers potential benefits for women needing urgent fertility preservation. It is essential to consult with healthcare professionals to understand the current state of this technology and its suitability for individual circumstances.